Guys, it's Javon Harley again, coming to you actually from beautiful Charlottesville, Virginia. I'm doing some work down here, and I just wanted to catch back up with you guys and talk about diabetes. Men, we need to be aware of the diabetes out there and what is it, what's the sugar disease. Some black folks may know that term, but diabetes is basically your organ, your pancreas is not either giving you enough insulin, or it doesn't combat the sugars that you have in your body. Couple of things is that it increases the risk of cardiovascular disease. Cardiovascular disease is basically affecting the heart. Thanks guys for joining. Patrick, thanks for joining. And it can also cause problems with your eyes, your skin, your kidneys, and your nervous system. Another big issue for men is it can cause erectile dysfunction. Erectile dysfunction is a neurological problem and a blood problem that does not allow enough blood to get into your penis so that you can have a proper erection. So I know that's a big concern for us men. We want to maintain our drive, our potency, and so we need to pay attention to our diet and the things that we eat. If we start to show any signs, symptoms, some of those things are if you're frequently going to the bathroom. That is one sign. Unusual fatigue. So not just your normal I'm working, I'm tired, but extremely fatigued, extremely tired, and you want to pay attention to those things. I have 20 years of experience in the medical field. I have been a nurse. I've been a combat medic in the Navy. So I do have the LPN license and nursing while I was in the Navy. Thank you for asking, though. I performed as a physician assistant. Thank you, Ashley, for so much for chiming in. I just really wanted to get through that other part, which was blurred vision, weight loss, even with a diet. So if you're getting a weight loss and you're not dieting, that's an issue. If you're seeing any numbness or tingling in your feet or your hands, that is a sign. So in combination, those things are an issue. No, Ashley, thanks. No, I'm not, but thanks for asking. That can be a concept. No such thing as a diet. And diets can affect you. There are some diets out there that actually do help. So lifestyle changes are a key. Balancing your meals and mixtures of starches, fruits and veggies, fats, proteins. Avoid excess sugar, especially soda. No such thing. Let me know what you're talking about, Ash. Only if you want to die. I'm not understanding what you're talking about. Help me so that I can give you the proper information. So the biggest overview is that diabetes is not good for our health. Soda is tasty, but you don't drink it. That is a true statement. I have drank soda plenty of times, and it's very tasty. Yeah, I agree, Ashley, that the soda is tasty. But I mean, it's not just sodas; it's overall those sugary drinks that are out there. So you want to be conscious of the sugar intake that you have. You want to be conscious of those signs and symptoms that I mentioned. The weight loss. Sex can be a good way to lose weight. You do burn a lot of calories through sexual intercourse, but if you have diabetes, your ability to perform may be affected. So thank you for bringing that up, though, Ashley. But again, the best thing, and I've seen it, and I personally helped other people achieve that goal, which was lifestyle changes. So exercise, changing those things that you eat. So having a good balance, a good mixture on your plate, definitely more vegetables, less starches, things like that will help with your preventing any diabetes. So I point this out for men especially, since we're doing a series for men, and it's great. King Wana, I'm sorry. So in performance, I talked a little bit earlier, Wana, about erectile dysfunction. So with erectile dysfunction, there's a decrease of the blood flow through the penis area that would affect the performance during sexual intercourse. That was just addressing a question that Ashley had earlier. So just to recap about diabetes and how it affects us, the increase of cardiovascular risk, how it can affect your skin, your eyes, your kidneys, your nervous system, the blurred vision, weight loss, tingling and numbness is a sign of pre-diabetic or having diabetes, frequent urination, and unusual fatigue. Guys, I really appreciate you guys coming in. Thank you, Ashley, for giving me comments, giving me some feedback. I look forward to you guys coming to my next one. I haven't decided the subject line. There's so many different things that we need to really talk about. Obesity, we need to talk about the prostate. Women on here, these are kind of subjects that you can have with your father, your brother, especially men of African descent. We need to address those things. I missed your question, Ashley. Forgive me. What was your question? Does tightening the walls burn calories? I have no idea. I am not a female. Are you talking about the walls of the penis? Well, I don't want to tangle up too much. I am actually on to another patient's home, so I need to get to them. Thank you guys so much, and I appreciate the time. Chime in next time, and I'll talk to you soon. Thanks again, guys.